Live, the morning show from KPSP Local 2, where local comes first.
Thank you, Carlene. Well, women apply makeup to contour their face, eyeshadow on their eyes, blush on their cheeks. But what about contouring the body?
When working out just isn't giving someone the results he or she desires, many turn to liposuction. In studio with us today from the Contour Dermatology and Cosmetic Surgery Center is our buddy, Dr. Timothy Jochen. Dr. Jochen, you say that many mistake liposuction for a weight loss procedure. I know that's what I thought before I literally read this at 3:30 this morning. What's the difference between a weight loss procedure and liposuction? Why isn't liposuction considered a weight loss procedure?
Well, liposuction is really an ideal procedure. It's the second most popular cosmetic procedure out there. And the reason for that is it permanently removes pockets of fat. And the ideal candidate is going to be somebody who has a stable weight and they just can't get rid of certain areas. So we can go in with liposuction, we can contour the body to give them a more ideal shape. It's not a weight loss technique, however, because you permanently do remove those fat cells. However, if you continue to gain weight, the remaining cells will swell and fill up the areas where you've had the liposuction. I've used it in people who are a little bit more overweight, and it really works if you're inspired to make some lifestyle changes where you get some exercise and you modify some of your diet. So it can be permanent.
So basically, I mean, I can't take off my shirt here, which is lucky for everybody in the valley. But if you pulled this out, you liposuction this out, if I keep eating, sadly, the way that I eat, it's just going to go back in.
If you're a person who doesn't have stable weight, so you're a person who's on an escalation course with your weight, if you take that off, the surrounding those fat cells are gone. However, if you continue to gain weight, the fat cells that are remaining will swell and get bigger and repopulate that area. But if you do maintain your weight, you're going to have that fat gone forever. So it's really exciting.
So you talk about, well, at your office, you do a certain type of liposuction. Talk about it, and how is it different from different types of liposuction?
Well, tumescent anesthesia is a numbing solution that's a water-based solution. So what happens with this is it doesn't require anesthesia or conscious sedation. So it's very exciting for many reasons. First of all, it really minimizes your risk with this procedure. Secondly, you're awake, so we can reposition you and we can really access all areas where you have pockets of fat. Whereas if you're unconscious, you're just laying there, so it's really hard to access that. Next, it really minimizes your downtime because you don't have any hangover from the anesthesia. And so you can really resume activity within a day or two. And
Really?
finally, it minimizes your cost.
Wow. So it's an outpatient procedure. How long does it last? How long, they can be in and out?
Sure. Typically, the procedure, if you have a small area, it's an hour. If you have larger areas, it may be a couple hours. So it's a really quick procedure.
And what areas do you recommend?
Well, any area where you have pockets of unwanted fat, and the most popular areas are always going to be, or well, in my practice, are the abdomen and love handles, because when you take the fat out of this area, you get more of an ideal shape. So for women, you're getting more your hourglass figure, and for men, you're getting more that V-shaped look. Other popular areas include the chin, because as we get older, we can collect fat underneath our chin, and so it can give a waddle-like appearance or a double chin. And so within 5 or 10 minutes, you've removed that fat from that area.
Quickly, how much does this cost? That's my first question. Second, what are the dangers to this? Because I think anytime you have some sort of an instrument that is, for a surgery in your body, there's always a danger.
Well, the technique, because you're not using the anesthesiologist or require a surgical suite, it's very minimal. So you can start out by getting chin liposuction for $1,500. Now, the risks with this procedure are really minimal. There have been no reported deaths with a tumescent technique performed by a dermatologist. And so the risks are very, very minimal. I've been doing this procedure for 14 years, and in my experience, I've never seen any serious complications whatsoever.
Okay, all right. I want to do something about this, and I probably should just work out, but at some point it may be determined that it can't, and me being an Italian American, we have a tendency to have a bonzette, and it can have really, really bad health consequences later on in life. So,
but you got to be serious, though, like you said. If
right.
you have the procedure and then you continue to eat like you do, it's worthless. Dr. Jochen, thank you so much for being here with us. Of course, you can watch this segment again online, kpsvlocal2.com. Just click Morning Show at the top of the page. If anyone has any more questions, they can always call your office. You have an office in Palm Springs and Rancho Mirage?
That's correct.
All right. Thank you very much.
Thank you.